Hello and Happy New Year to each of you and to your families. It is with much gratitude that we acknowledge you for the continued success of University Medical Center. Your hard work makes the hospital thrive. So, on behalf of administration, thank you very much for all you do to serve. February 6th through the 19th, we will have our annual Employee Satisfaction Survey. Thank you once again for your faithful participation each year. We need and we appreciate your feedback and comments. I can promise you every single comment is read, every department's results are examined, and we do use your feedback to influence our actions. There's a list of changes and improvements made at UMC since the last survey available in this month's progress notes. It's important to me that you know about our strategic plan, our direction and focus for 2017. Our first pillar is service. Service is our passion is so much more than just the name of our culture. It's the why of our organization. It separates UMC from the rest, and it defines our shared values. This year, we plan to examine the entire patient experience, from the initial connection to the lasting impression. And based on what you have told us, we will also improve our service to each other and our respect for one another. Strategically, that's a priority for us. Again, thank you for your feedback. Let's talk about quality. Patient flow, hand washing, infection control, staffing, and harm are all focus areas for 2017. As a health system, we are not alone in these challenges. Improvements don't come easy, but we can and must improve the flow and safety of our patients, working together, being innovative, and using lean methods. The main point is this: you have accomplished a great deal in 2016, from baby-friendly to most wired, and certifications in VAD, PD trauma, and transfusion services, just to name a few. So I believe that same dedication will drive quality improvement in 2017. Stewardship is defined as the careful management of something entrusted to our care, mine and yours. That includes a lot. We are entrusted with our facility, our time, our brand or image, and with each other. We did see some terrific stewardship in 2016 as performance met an increased demand. Caregivers from EMS forward served more patients than ever before. Examples of areas behind the scenes that made a big impact include central stores, food and nutrition, and decision support. In 2017, we will conduct our second Waste Walk in an effort to harvest as many of your good ideas as we can. All savings will contribute to a larger Sharing Success bonus payout this December and a stronger financial base for our future. Our next pillar is teamwork. I said this last year. Your administrative staff team sincerely wants you to find joy, fulfillment, and purpose in your work. That has not changed, and it never will. We know that without your hands, rooms are not cleaned, instruments are not passed, bills are not processed, transfers are not accepted, and repairs are not made. Teamwork is a major priority for 2017. Beyond retention, we are using your feedback to strengthen our culture as a place for long-term satisfaction, joy, and fulfillment. That requires a renewed focus on respect and communication. Both will be a key focus for 2017. When you look at growth, we are blessed in that the UMC brand, the one that you are building, continues to strengthen throughout the region. We have seen considerable growth in overall admissions and visits, and specifically in cardiac, endoscopy, oncology, and radiology. In 2017, we will introduce Southwest Medical, our women's center on 82nd Street, the new Business and Technology Center on North Slide, and we will finally expand our kitchen among other areas in the basement as we accommodate the new East Tower beds in late 2017. So we are definitely growing. For all you have done, thank you for showing that service is our passion. Happy New Year.
It's a privilege to serve. It's a privilege to serve the people and nourish the people who take care of people. We also have the privilege of taking care of patients and families. The most important thing we do is safety. A clean environment is at the cusp of everything we do. When we provide a clean environment, it ensures safety for our patients. We don't have to bring a lot of bad news to patients. We have the privilege and the opportunity to be the happy spot in the day. I'm really excited about what's on the horizon for our department. Our kitchen is small and it's crowded. It's high energy, it's loud, but the people in our department work together so well. The reason we've been able to do so much in a smaller space is our people.
I'm a supervisor. I oversee 12, 13 hostesses. I like to make a difference with the patients in feeding them and taking care of them.
Well, I'm the baker, so I bake the cookies and the dinner rolls and for the patients. And I come in early, but you know, time goes by real fast because I enjoy what I do. And it makes me feel good to know that they enjoy my desserts, my baking goods.
I'm a cook, and I cook for World Station. I enjoy my cooking. It's a passion of mine, and I enjoy helping people. And that's what I've been doing forever, and I love it. Just helping people to make sure they get well.
We will turn away hundreds of patient transfers this year. Patient flow, overcrowding, and patients in hall beds is a big reason why we need to make good financial decisions for the future. The decision to build a 45-bed unit in the East Tower is a great example of how decision support plays an important role in the hospital, helping leaders make better decisions for the future. Before construction was even approved, decision support was tasked with determining the financial impact of creating a new unit in the East Tower, and we created several scenarios to help us determine what would be the best decision for us. Expenses and new revenues were projected, as well as determining the impact on other units in the hospital. The new 45-bed unit was a complex project that crossed construction, nursing, EVS, even food and nutrition, among others. So the data that we collected and analyzed helped UMC know the true cost of opening this new unit, but also the cost of running this unit. In the end, our financial data helped create a new clinical unit, which is now currently under construction. So why do we even do this? Because we want the best for our patients and our hospital. Our success depends on good decision making, and good decision making supports our culture, which is our why at UMC.